Is that more in line with where we need to be?
Yeah, thanks, Whit. I mean, first of all, phenomenal to see this briefing led by science, really focused on transparency of where we are at and where we need to be. Obviously, the focus on public health and equity. And so, yes, I mean, it was great to see that we're starting to really ramp up the distribution at 1.6 per day. As you heard from Andy Slavitt, this is, the 1 million a day was a floor. And of course, they didn't know what they were inheriting coming into the White House. So I think, that was a reasonable target. But given that, one, we've increased our ability to vaccinate with new immunization centers and really getting the supply chain figured out and figuring out the transparency so states fully know what they're getting, I think we could start to see well above 1.5 per day to 2 million vaccines per day. And that really can get us so much faster to that herd immunity threshold as, you mentioned, these variants are coming into play.
And speaking of the supply chain, this bottlenecking that we've seen experience at the state level, I mean, I was at a hospital last week where they were running out of first doses of vaccine here in New York, and they were just going day to day. They actually didn't even know when the next supply was coming in. The Biden administration has promised to be able to give states 3 weeks advance notice so they can start to plan. How much of an impact and how quickly will we see these things result in more people getting shots into their arms?
I think it's going to make a huge difference. Remember, I mean, we've been reporting on the fact that, nursing homes, long-term care facilities had almost like a glut of supply in many cases because it was sort of overestimated the need in those facilities while we were really underdoing it for the community where, we've seen the expansion of eligibility groups. And states didn't have a ton of flexibility to reorient that supply, and they didn't have a ton of visibility of where it was going. And now with this ability to give that 3-week visibility and the federal government sort of committing to this like 2-day rolling average of supply, it's going to really make sure that these places where there's high demand are getting the vaccines and of course opening up appointments because we know so many people across this country are checking daily to see if they can get their appointments. Finally, I think that supply will come in to meet that demand.
Another thing that we've been hearing from the administration is the talk of 200 million more doses coming from Pfizer and Moderna. That would bring the total up to 600 million by summer. So the idea behind that is that we would be able to vaccinate roughly the entire U.S. population by the end of the summer. There have been some questions, though, about, the speed of all of this. The end of the summer, just to have the vaccine in hand, is that fast enough to be able to get to this herd immunity that most believe that we need to get to get back to some state of normality?
Yeah, I mean, listen, of course, we'd love to see, hundreds of million vaccinated in the next couple of months. I think that's going to be a challenge. But we should always remember the fact that the first rollout is going to those that are at the greatest risk of complications from the infection, right? Elderly, those that are immunocompromised, those who have underlying chronic conditions. We're going to eventually, in the next month or two, get coverage across that high-risk population. So we'll see the real sort of return to normalcy. Even if we haven't quite reached herd immunity, we'll start to see that light at the end of the tunnel sooner, I think, probably by April or May. But by the time we can really get everyone access and actually start to really resume our normal day lives, unfortunately, that's a little bit into summer. But I think it's going to be more of a gradient than this sort of binary. By the end of the summer, we can start to go outside again. I mean, that's what I'm hoping. I think it's achievable. And remember, we also have this J&J vaccine that we're going to get a report out hopefully in the coming days or if not week. If that gets added into the mix, again, that is about another 100 million doses. That could really ramp things up as well.
And that Johnson & Johnson vaccine is just a single dose, so they could probably get that out to some of the more rural areas that have had trouble dealing with the Pfizer and Moderna vaccines. I do want to ask you, though, about the variants and some of the updates that we're getting here, more of them being detected in the United States. Dr. Fauci laid out the plan and the efforts to try to deal with them in terms of therapeutics and vaccines. What was your biggest takeaway in terms of, what happens if these variants outpace the vaccine rollout?
Yeah, I mean, that's the big question on all scientists' mind right now. Like, it's a race between variants versus vaccines and which can we do faster. And so, of course, this puts a lot of stress on the rollout of the vaccines. But of course, we need to figure out how well these vaccines do with these new variants. And as you saw, J&J actually did some of its clinical trials in South Africa and Brazil. So we'll know pretty soon how well in the real world these vaccines will do. I mean, you heard Dr. Fauci mention the fact that there's been some, at least in vitro analyses that have shown that the vaccines will still perform well against these variants, although not quite as well. We've seen that reduction in neutralizing antibodies. So that is a concern, but these vaccines have a good amount of buffer in them. So far, we think we're in actually pretty good shape. But of course, we're going to get some readout on some really important data out of J&J very soon. And that will really determine the course of where we think we might be in this pandemic.
Some hope on the horizon. We're looking forward to that. Dr. John Brownstein, always appreciate your analysis. And we also like the Dr. Fauci throw pillow on the couch behind you there.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.